Hi, my name is Scott Lust. I'm a pharmacist by training, and I currently work for Cardinal Health as a clinical data analyst. I've been a pharmacist for 33 years. I've worked in retail, I've worked in mail order, I've worked in specialty. So I've done a variety of roles in pharmacy throughout my career. I'm interested in this topic because when I went through school, the focus of the education at that time was largely on the product. And there was a lot of classes on the product and on compounding in the wet labs, and we would even have exams on wet lab compounding. And I think early on, like dermatologists and endocrinologists were maybe, we could think of them as kind of one of the earliest proponents of precision medicine, in that the endocrinologists were writing compound prescriptions for hormone therapy and progesterone suppositories to treat infertility, and the dermatologists are writing very specific orders for compounds for some of their patients. And so early on, at least in my career, started, looking back, I'm starting to see that as early attempts at precision medicine. And through experience in dispensing for the years that I worked in retail, it wasn't difficult at all to notice that different people would come in and talk about how their medications were affecting them, and it would be completely different from someone else, even at the same dose and regimen, et cetera. And so it was clear that there were differences in the way people were reacting to their medication. And we had an idea that at that time it would just be, well, everybody's different, and people are expected to, I guess, interact differently or react differently to the medication. As time has gone on, though, that rationale has really become into, we know that there are genetic components, or there's genetic influence in a patient's makeup that influences how drugs are metabolized and how the clinical benefit is either realized or it's not realized. And so this is really interesting topic to me, because it's really a nice blending of kind of the old, of compounding in a traditional sense, where, we may someday see that we are printing tablets, with a very specific dose for a person based on their pharmacogenomic profile. And so it's kind of the art of compounding, again, in a different way, but in a very modern setting with a really precise focus. And that's really interesting to me. I'm not sure that I'll see that in my career before it ends, but it's definitely the way I think things are clearly moving. We make therapeutic decisions based on receptor type status for breast cancer, for example. And that was another really big advance, I think, in pushing the topic of pharmacogenomics and precision medicine further into the mainstream. So I think there's becoming a greater acceptance of it, as there should be. There's a lot more data to collect, and it will be really interesting to see where this might be in 5-10 years.